Hello and welcome to this Psoriasis Awareness session. I'm Dr. Anushka Amlani from Integrated Health and Wellbeing Council. This interaction with the top dermatologists from the length and breadth of India is aimed to spread awareness about psoriasis. Today, on account of World Psoriasis Day, we will be talking to Dr. Murlidhar, Head Department Dermatology, Apollo Hospitals, Chennai. Psoriasis is a disease that is not just skin deep and affects approximately 10 million people in India. Psoriasis is also not fully understood, and with the launch of Live Life Limitless, an awareness campaign, we aim to make an impact on the awareness of psoriasis, right from the basic do's and don'ts to the advancement in therapies. Once again, I would like to welcome Dr. Murlidhar to share his valuable insights with us today. Welcome to the session, sir.
Thank you very much, ma'am. Thank you.
So, moving on, my first question to you is what is psoriasis and how does it impact the patient's life?
Psoriasis is common, affects almost, I would say almost 3% of our population. We don't have exact figures, but it is a systemic disease. You should stop thinking of it as a skin disease. It's a disease of the system where there is very severe unregulated inflammation. And this unregulated inflammation shows up on the skin as scaly, red, very itchy patches. The extent can be different, maybe just one patch in the patient, or many patches all over the body, or even 100% body involvement. You cannot actually classify psoriasis as something that's going to be limited only to one area. So it has a very variable course and it reflects a very severe systemic inflammation in the body, irrespective of the number of skin lesions that you see. So it has a serious impact on the health of the individual. It is not a communicable disease, and I'm going to even end my discussion with you saying that this should be classified as probably the most important incident.
So, uh, could you elaborate about the impact of psoriasis on a day-to-day life of patients undergoing the treatment for psoriasis?
Take the simplest and easiest thing. I have a patch of psoriasis on my face. Um, and I may have nothing anywhere else in the body, but you have a single patch on the face, and this webinar would be a problem. I would feel shy of sitting in this webinar. This happens to people. These are all what we call as high impact sites. Let's say a person has psoriasis patches on the palms. There are thick, scaly, reddish patches. Or a person has psoriasis on the genitals. Can affect work, can affect marriage and social responsibilities. And then, of course, you have psoriasis, which affects the whole body, which makes it difficult to work, makes it lower self-esteem, depresses the patient. In fact, we have something called as EQ5D, which measures certain important aspects of a patient's life, which I've just covered. Ability to work, ability to function, self-esteem, physical disability. Because what people don't commonly understand is that psoriasis can affect the joints also, and joint pains can be fairly debilitating and prevent you from working. So the impact on life is significant. And ultimately in psoriasis, there is a connection with the comorbid conditions. Comorbid for a general public would mean other medical conditions which coexist with psoriasis. Very common problem is diabetes, hypertension, high BP, problems with the cholesterol, obesity. All this works together and ultimately affects the heart. In my hospital, where I practice itself, if you see the number of patients who are turning up for cardiac events, many a time I'm called to give clearance for surgery because these patients have been suffering from psoriasis for a long time. It can also produce events like stroke. We have seen patients who have had, after all, atherosclerosis, that is thickening of blood vessels and narrowing of blood supply, can happen anywhere. So I think psoriasis is a very important disease. It can impact every part of the patient's life. This is going to be very brief with you. I can elaborate on any of these if you like.
Definitely, sir. You've partially answered my next question, but I think you can elaborate more upon the chronicity and the long-term complications of psoriasis.
See, it's like this. You should not tell your patient that psoriasis can be cured, though I find that patients think that just because something is on the skin, it must necessarily be cured because they don't want to place too much importance to it. However, it is important to tell our patients that psoriasis can be well controlled and we understand the disease to a large extent and we can manage the complications. So, what are the complications? In the long term, actually, every year that you don't treat a patient with a psoriatic patch on the skin, there is a 6% higher chance of the patient developing joint involvement. The commonest type of joint involvement is in the small joints of the hands and feet. So that is what's going to impact work directly. And then, of course, I mentioned a few in the previous discussion I had with you just now. Psoriasis patients are more prone for hypertension or high BP. That's directly correlated with atherosclerosis. Psoriasis patients are also prone to cholesterol problems and major adverse cardiac events. But I would say that major adverse cardiac events need not be necessarily confined to the heart. It can be confined to lower blood supply in any part of the body. A few other important things which people don't talk about, but which are very important, is that almost 40-50% of very long-term psoriasis patients have problems with the liver. This is important because lifestyle is going to impact the liver, and some of the drugs that you take in the routine management of psoriasis are going to impact the liver definitely. Renal involvement is well known, and it is a lung disease or interstitial lung disease has also been documented in psoriasis. The list is endless. But let me sign off with one statement that unregulated inflammation in the body, if it is left alone and it goes on and on and on, leads to what we call as malignancy or cancer. There are a couple of types of skin cancer and cancers in the body which are seen in end-stage psoriasis patients. What stage are you going to see it? When are you going to see it is difficult to predict. But when the immune system is getting inflamed, it is not doing its actual job of surveillance of what is happening in the body. So things go out of hand very fast. This is like a doomsday picture to you, but actually these are the long-term complications.
Thank you so much, sir, for the valuable insights. Moving on, sir, what are the treatment options available to patients undergoing the treatment?
Some of the treatments are very, very skin directed, just directed only to the skin. This is a slightly older understanding of psoriasis. It goes against the grain of what I was talking to you about just now. So the skin-directed treatments are using an external cream, most commonly a topical steroid or a vitamin D derivative or a vitamin A derivative. You can use many of these for very, very limited disease. And then you have, of course, treatment with ultraviolet light. I'm sitting in a place which is next to the beach, not just in the virtual background, but a lot of ultraviolet light. It actually helps the disease. But it doesn't, these skin-directed treatments do not alter the systemic disease. You have amongst the systemic interventions, you have conventional drugs, which are the conventional disease-modifying anti-rheumatic drugs, what they're called. These are methotrexate, we have retinoids, we have cyclosporin, we have acitretin, so these kind of treatments are conventional treatments which we have. They are tablets. They are, the hallmark of this is that lower efficacy and poorer safety records. Each of them has a target organ effect. The other forms of treatment that we are actually looking at nowadays is the biological interventions, because this is highly targeted. Most of the conventional treatment approaches are what I always call a carpet bombing exercise. Knock out everything inside. There is no precision targeting of the disease molecules. Being an immunological problem, there are several immunological pathways which create psoriasis. So you can target one particular dominant immunological target, and that would be very targeted treatment. And this is the age we are in, the age of biologics.
Thank you, sir, for introducing biologics. Moving on, sir, how and why does biologic help the patients live life limitless?
The thing is, when a patient is disabled, when you look at whenever you look at econometrics, you're going to measure the quality of life of the patient. If the quality of life of a patient is impacted by psoriasis, which it is, and very significantly, your audience needs to understand that next to cancer, psoriasis is the second most important cause for suicide, anxiety, depression. So if you really want to live life limitlessly, if you really want to do that, whatever be the definition you're putting in, you need to be physically, mentally, and socially normal. Health is a sum of all this: physical health, mental health, social health. Let's forget the spiritual health part. But the question here is that the biological is going to be highly effective because it is going to target the most important pathway that is producing psoriasis and affecting multiple different organs. So therefore, biologicals are important and they are able to give relief in multiple areas for the patient. And over a period of time, many of these disabilities that we have spoken about, we see there is a trend towards them becoming better. But yes, that has to be combined with lifestyle changes. And I do think that if a patient intervenes with the now, when you talk about a patient who's already got well-developed systemic complications with biologicals, it will be too premature for me to tell you that a biological is going to get rid of that. It will be very premature. However, if I was to tell you that you treat a patient with the biological very early on in the disease, identify the dominant immunological pathway in that patient, you may be actually able to get rid or prevent the onset of complications like cardiac complications, obesity, metabolic syndrome. All this might actually be, maybe if not prevented entirely, at least you may be able to uh, allow the patient to lead a much more normal life than he would otherwise.
Thank you so much, sir, for helping us understand the importance of biologics in management of psoriasis. Moving on, my last question to you for today's session is: what is the importance of regular doctor consultation and therapy adherence to live life limitless?
So very simple. Uh, a doctor is going to tell you what limitless means. That's very important because people should not have a wrong impression of what limitless is. Unless and until when you're going to use a very advanced molecule like a biologic, I'm sticking to that because I feel that psoriasis patients should be afforded uh, the ability to get biologic therapy earlier. So I feel that only a doctor who understands the immunology of psoriasis should use a biologic. And therefore, a patient should visit a doctor regularly because an assessment can be made on how the drug is acting, how well it is responding, how is the patient responding, are there issues which we have not targeted with a particular drug, and the overall comfort of the patient. It's also important to understand that the dosing of a biological depends a lot upon the patient's response. We should also understand that when a patient is on a biological, he can develop any other medical problem independent of the biology, independent of the biology. So a doctor needs to treat that because you cannot let that go untreated. Unless and until you see a doctor regularly, he will be able, he will not be able to help you understand your disease and how to tackle and manage your disease. You see, I'll end with only one statement. You know, the very important thing about a biologic is it actually reduces the number of visits to a doctor as compared to a conventional disease modifying drug like methotrexate or retinoids or phototherapy. But a biologic, you may need to see a patient only once in 3 months. But don't give up on that once in 3 months also. Maybe initially it's more frequent, but after that, at least see the doctor once in 3 months so he makes a complete assessment of how you're doing. There are multiple reasons, and one of the most important reasons for this is dosage modifications, adding other drugs which could improve the response of the patient, looking out for any other markers that we need to intervene in the psoriasis patient's life. All this can help a doctor personalize your goals on what you as a patient think is living life limitless. The doctor needs to help you to understand that goal. And he's using one tool for it. And that tool is an intervention for your psoriasis, which we call a biologic.
Thank you so much, sir, for your valuable insights today. As we conclude this session, I request you to give your conclusion remarks for the World Psoriasis Day.
My concluding remarks on the World Psoriasis Day are two parts. I honestly don't know the reach of this service that you have rendered. I do hope the reach is really big. The first would be that request the government of India to include psoriasis as the top the non-communicable disease. We are talking about cardiac disease, and everybody gets cardiac disease insurance and reimbursement and all that. If you're going to be able to give your patients the ability to treat psoriasis better, because we know it is a very, very, very big risk factor, and we have seen this happening. So I think psoriasis should be the number one non-communicable disease in India. It's a huge population, and a patient with psoriasis suffers all his life. And this, we have to also make sure that we place value on quality of life and the performance of the individual economically. So that is going to be impacted by psoriasis. So the second message over here would be, please understand the seriousness of psoriasis. I am very shocked to see that insurance companies label psoriasis as a cosmetic disease and do not reimburse patients for costs on psoriasis therapy. This thinking has to be changed. It's a very, I think for insurance companies, it's going to be an earth-shattering event to change their thinking. The question over here is, if you're able to afford good treatment to your psoriasis patients, you may be able to save on insurance premiums or insurance reimbursement for more serious complications in the future. Insurance has to be looked at. It has to be a governmental decision.
Definitely, sir. It has to be a collaboration of all sectors to improve the healthcare system and infrastructure. Thank you for your valuable insights today, sir. It was great talking to you.
Thank you very much, Doctor. It's a pleasure talking to you.